doctor felt a cyst, and when I look at it under ultrasound, it is far from a cyst. And we really need to make that differentiation. So ultrasound specifically will be able to tell if a cyst is simple, complex, or complicated. And simple cysts are the most common type of cysts. Simple cysts do not have malignant potential and are always benign. So if you are told that you have a simple cyst based on ultrasound, then you are free and clear. And unless they are bothersome, so if they're painful or disfiguring the breast, nothing needs to be done about them. And they do not need to be followed. Now, alternately, complex cysts are irregularly shaped. They may have a very thick wall. They may even have some debris or floaters inside when we look at them under the ultrasound. They may have a solid component, so they may be partially cystic and partially solid. Or they may otherwise look simply less than simple. And these cysts will likely need a biopsy. At the very least, they will need an imaging follow-up. And then finally, complicated cysts are usually defined as a combination of the characteristics of simple cysts and complex cysts. And these also will likely need a biopsy or at the very least imaging follow-up. And some providers will use the terms complicated and complex for cysts interchangeably. So if you're told that you have a complex cyst, it may simply be a complicated cyst. It doesn't really matter. They're very, very similar. And also it's important to know that hearing that you have a complex or complicated cyst should not make you immediately concerned, because the fact is that these also will often be proven benign with a biopsy. And that makes sense, because I want you to think of it this way. If you take a glass of water, so especially in cysts that have been around for a long time, if you take a glass of water, right, just plain water from your tap, and you leave it out for several days or several months, eventually that water will start to look cloudy or even dirty, even if you don't do anything to it. And there's something similar that occurs with cysts. So even if cysts have little floaters inside or they don't quite look 100% crystal clear like a simple cyst, that doesn't necessarily mean that there's anything bad going on. Now, alternately, please also remember that being told that you have a simple cyst does not mean that you will not develop breast cancer or another abnormality in the future. So you still have to have your screening studies regularly. You don't get off by just saying you have a cyst and everything is good.